And we are back. Thank you so much for standing by. We appreciate your patience. Of course, we are about to segue to the next phase of today's show. I told you we're going to be together till 11:30 a.m. We've gone through the conversation with Dr. Amadi Dorobuchi, and now we're about to talk about diphtheria outbreak in Nigeria. We're going to pay a lot of focus or place a lot of emphasis on the spread of this particular infection in Kano State. But then again, I trust us to provide you with foundational knowledge about this particular outbreak. That is for those of you who probably do not have insight into the outbreak and how it has been across the different states. I have a guest, of course, like I introduced earlier, but before we connect with our guest on air, I would like to, like I said before, provide you with certain information regarding diphtheria in Nigeria. Now, the Nigerian government on Monday have confirmed over 7,000 cases of diphtheria recorded in 18 states, including the Federal Capital Territory, with 453 deaths occurring from the infection. It has also noted that over 5,000 of the confirmed cases, which constitute 73.6%, occurred amongst children aged 1 to 14 years, with those aged 5 to 14 bearing the brunt of the disease. The devastating impact of diphtheria outbreak has caused UNICEF and other related medical organizations to raise an alarm regarding the need to promptly control the spread of this scary infection. And unfortunately, of all the states that has been hit by this infection, Kano State has reported the highest number of suspected cases, which stands at about 5,800. And we also have the Director General of Kano State Primary Healthcare Management Board, Dr. 𝗪𝗵𝘁𝘀𝗪, indicating that about 520 children are suspected to have lost their lives following the diphtheria outbreak in Kano State this year. So joining me this morning on Health Plus to discuss extensively diphtheria outbreak in Nigeria, like I said, with emphasis on its prevalence in Kano State, is the Deputy Director, Public Health and State Epidemiology.
Yeah, good morning. Good morning. So much. You're welcome.
Yes, some of the symptoms.
Because people who travel usually because it's a complex good system, they can system affecting the heart or the renal system, affecting the kidneys, and to have readiness around in that is the fact that if people that are confirmed to have this infection do not receive prompt intervention, of course, due to diphtheria infection, it is what, of course, this is questioning the current reality and the credibility of the system, especially the quality of routine services, the relevant vaccines for the uninfected ones, and of course for the contact of the infected and the high-risk people, especially during this vaccine through mass vaccinations that are currently ongoing. This is in addition to other efforts of using face masks among papers can easily be sorted out.
Dr. Aya, yes, I really wanted us to separate the conversations because the issue of vaccination is a whole different topic on its own, right? But I'm glad that you now, because you are the state epidemiologist for the Ministry of Health in Kano State, the current trend and pattern of diphtheria in specific regions, Kano State now, we have the World Health Organization and even other health organizations reporting figures as high as 6,520 deaths. In fact, UNICEF says that Kano State constitute about 80% of Kano State. What is increasing the susceptibility of people in Kano State to diphtheria?
Okay, so thank you very much. I think this question is very relevant. Let me first start by saying that we need to look at the current reality of Kano State. It's one of the most populous states in the country. We have 44, some are even saying 20 million. And of course, this is by nature of our lifetime. This is a region that is predominantly Anya, and in addition, is one of the most relatively peaceful states in the north. So it's becoming a very conducive environment for so many people coming from far and near for businesses. Some of them resettling in Kano, and in addition, it's also a place that receives so many of the internally displaced people from around the other northern states that are bedeviled by insecurity. So there are so many factors that could have contributed to this current reality. Of course, some of them are Nigerians. They have every right to live in Kano. They have every right to choose where to live. And it is our responsibility to ensure that we are able to provide them with services. The other very important factor that people are considering is the fact that when we discovered and confirmed this outbreak since December 2022, the state government, with the support of development partners, the healthcare workers, actively looking for these cases. And equally from the state, we have what we call robust contact cases are just coming like that. We are actively looking for them. We felt it to bring them to the treatment center. Another very important reason is the fact that we've established a very robust treatment center, and parents have seen evidences. Most of them, they get admitted, they get treated and discharged. So people are now bringing out cases, and the team are equally there in the field looking for them. And of course, we will say that we are winning.
Those are some of the factors that are responsible for probably why the outbreak is more prevalent in Kano State. So earlier, when you were giving us a general overview of diphtheria, you spoke about vaccination. In fact, you laid a lot of emphasis on vaccination, or in this case, the lack of vaccination, especially in children under 15 years old. I would like to ask you to talk to us about what exactly would you say is responsible for this vaccine hesitancy as seen in people. We will talk about northern Nigeria, but even in the general sense of it, generally in Nigeria and maybe even Africa, it's a lot of people who do not believe in vaccination, despite the fact that there is all this evidence that it can protect them from diseases, it can protect them from, viral infections like diphtheria that we're going through at this particular time. What would you say is responsible for the vaccine hesitancy that we're still seeing in the country?
Okay, so like you rightly said, vaccine hesitancy is talking about delay in all the crannies of the country. The concept of vaccine hesitancy is a complex one, it's multifactorial, and it is not only an African issue or Nigerian issue, it's a global issue. We have in different parts of the world. But coming down to Africa and Nigeria, I think we can be coming a bit hesitant to vaccination. We can look at the current reality. One of the factors is the issue of knowledge, having the information, the right information about what is this vaccination all about, how is the vaccine made up of, how does it work when it goes into the body system, to what extent does it confer protection. This gap in knowledge and information is one of the factors that can be implicated in the concept of vaccine hesitancy. And then another very important reason that we can consider is issue of trust. Trust on the system. How trustworthy is the public health system? How trustworthy is the public authority generally? Will the public have good trust on the administrator? This is an area that I feel safe. I believe that what this is bringing to me is something that will fully work for me. This is another very important factor that experts are considering. Of course, looking at other issues of misconception and misperception regarding side effects, people thinking of what we call the adverse event following immunization getting exaggerated. Some of them are not fully related to the immunization, but because nobody is there to guide, nobody is there to defend those decisions, people misperceive those other things appearing after immunization as if they are coming directly from the immunization itself. So for me, these are some of the realities. And then looking at the other related context, generally issue of the health-seeking behavior. People still felt there are traditional reservations as to how they seek for their health care. Some people are still being traditional in handling the affairs of their health system. So these are some of the issues. But like I said, it's multifactorial. The factors in Kano may be slightly different from those in Lagos, may be different from those of Nigeria, different from those in other African countries, and so on.
Right. Well, if you're just joining us, this is Health Plus on mainland 98.3 FM. We're talking about diphtheria outbreak in the country, and we're talking more specifically about the prevalence in Kano State. I do have joining me virtually this morning to give us insight into this condition, Dr. A.I. Karamata. He's the Kano State Deputy Director, Public Health and State Epidemiologist for the Ministry of Health in Kano State. He's given us an overview of diphtheria being a respiratory condition. He spoke to us about some of the signs and symptoms, the mode of transmission. It could either be fluid from an infected person. It could be skin-to-skin contact in the case of, the cutaneous manifestation of diphtheria. We spoke about the fact that vaccine hesitancy might be a problem because diphtheria is a vaccine-preventable infection, meaning if you are vaccinated, you most likely would not suffer from the disease or infection, allow me to say. But we have a large number of children under 15 years old who are unvaccinated, or at least did not complete their vaccination schedule, and so they are susceptible to this particular condition. If you want to be a part of the show, you want to ask questions of the doctor, please do so by calling 0913 6000 410 or send us a text message on 0913 6000 430. I'm still going to speak a little bit about vaccination before we go on ahead to speak about prevention and maybe even the diagnostic methods when it comes to diphtheria. There's the 𝗵𝗲 vaccine that is given to children to protect them from life-threatening diseases like this one, right? So would it be reasonable to maybe insinuate that diphtheria, when it could be, like you said, is not a new infection, but the way it is presenting now, would it be reasonable to assume that maybe the 𝗵𝗲 vaccine was not exactly able to protect those who had taken it? Or would you say they did not complete their doses? Or would you say that it has evolved in such a way that the 𝗵𝗲 vaccine was unable to protect the children? Because there are some kids who apparently had gotten maybe the first dose of the 𝗵𝗲 vaccine, but they presented with signs and symptoms of diphtheria. How do we reconcile this situation, Dr. AI?
Okay, so I think I will use the data to answer this question. First of all, let me say that from the record, at least in Kano and even in different other states that are reporting cases, more than 60 or let me say 70% of these cases are people who have either not even been vaccinated completely or have not completed their vaccination. So this is telling us scientifically that those that have completed vaccination are at a lower risk of coming down with this infection.
Okay.
This is portraying the importance and the, of course, efficacy and potency of this vaccine. The other thing I would use to answer this question is the fact that Nigeria is one of the countries leading in the world in terms of the number of zero-dose children. Zero-dose children are those who have not taken even the 𝗵𝗲 vaccine. The burden of zero dose in the world is now India leading, followed by Nigeria, and some literatures are even saying Nigeria is trying to overtake other countries, even India. In Nigeria, we have more than 2.2 million zero-dose children, and of course, Kano is not exceptional. In fact, Kano is one of those states that have this large budget of zero-dose children. So for me, I would still say the vaccines are very effective and they work, and evidences have shown that those who are truly vaccinated have extra protection against this infection. This is because most of those that are infected are people who have either not taken the single dose or who have not completed their immunization completely.
All right. Thank you very much for that. Now, let's talk about the diagnostic method for diphtheria. A person presents with the signs and symptoms. What are the steps that are taken to, first of all, of course, ascertain that this is diphtheria we're dealing with?
So ideally, by protocol, every suspected person is supposed to have the laboratory test. And for you to even suspect somebody with diphtheria, you must use a clinical test definition. We have what we call clinical test definition, clearly defining what are supposed to be there for you before you suspect a diphtheria case. Now, when you satisfy those criteria, the next thing is to have a laboratory evaluation. And the simplest one we do is taking your sample for microscopy and culture, usually in the two culture, either of the respiratory or nasal swab. They are able to isolate this bacteria, the 𝗪𝗏bacterium diphtheria. Of course, they can go further to test whether that bacteria isolated is the toxin produced inside or not. There are other molecular testing that can be done to be able to ascertain the diagnosis. But as it is currently, looking at the epidemic wave that is flowing in the country, we use other scientifically and epidemiologically proven methods of making diagnosis. Let me give an example. you may not have the resources, both at the state and national level, to be able to test every suspected case. Even if you do, the timeline requires for you to take the sample and process this result and get your result before you commence treatment might be not favorable in saving the lives of these people. So usually we use other symptoms. And all those symptoms are particularly with cell compatibility matching, actually similar to those who have already been confirmed using the laboratory technique. It's also considered compatibility matching. This actually during epidemic of this number in the social confined place that are confirmed positive. Now, any other person within that radius with similar symptoms can be considered confirmed with measles. The same protocol is been applied for diphtheria. However, let me commend LCGC and all the key stakeholders and the state government that we are now able to scale up testing. We've optimized a laboratory in Kano. Now in Kano, we have 2 laboratories that are able to test for diphtheria. So we are struggling to ensure most of the suspected cases are now tested using the laboratory approach.
As a matter of fact, that leads me to my next question, because I was going to ask you to speak to us about the endeavors of the Kano state government in correcting, or should I say arresting, this particular situation, right from improved awareness to tracking affected patients to Kano state. Talk to us about what the government has been able to do in managing this situation.
You have seen that we have been doing. Let me say from December, Kano state government through the TWG assemble all the experts, all the technical personnel, all the partners working in Kano to work together as a team to contain this outbreak. Some of these pillars include surveillance and ethics. You have laboratory pillar, you have case management, handling the management of positive cases. Of course, the surveillance is looking for the cases, community engagement pillar that has been engaging the community, raising awareness through direct advocacy to the community and religious leaders. And then, of course, other relevant activities, especially we are able to contain them. Let me go to the specifics. If you look at surveillance, we have what we call rapid response teams at the state level and at the LGS, especially at the high level body LGS. These are teams that are stationed, waiting to be called for any of any report that is either at the level of rumor or reported directly using the community surveillance structure. A detailed investigation and first aid there in the local government. Whenever a suspected person could, they list them, they get their contact, they follow them up to a maximum period that is recommended for what we call contact follow-up. Some of them that develop symptoms along the follow-up, they are taken up to the isolation center, while those that have completed the period with no symptoms are now discharged. And we equally have what we call the community active case search teams in almost all the high-burden communities in Kano State. These are people volunteers, also more than 100 cities mounting the treatment, and this patient are given Kano State with the diphtheria antitoxin to complement the effort of the government. Recently, when we saw rising number of cases, we opened another treatment center within the state infectious disease hospital IDH. We are now looking at congestion because in the course of using public transport for those suspected cases coming to the treatment center, they may end up cross-infecting themselves. This has shown that these cases are going down. If you go to other pillars like the lab, I've just told you optimize a lab. I think in the whole of the country, if you remove maybe the FCT or maybe Lagos, only Kano now has a lab under the state government, in addition to the one in Amini Kano teacher hospital that are comfortable. This is the best way to handle it is to do mass vaccination campaign. As I speak to you today, we've just finished a press brief with the Honorable Commissioner signaling the commencement of mass diphtheria vaccination campaign starting from tomorrow, Saturday the 30th. And we will be doing this in metropolitan LGS that were initially the hub of this infection. So we have this plan, we keep doing it, and the government is providing all the necessary support. The partners are there. We are doing it as a team. I think it's a teamwork, and
Sometimes, we can be very relaxed when infections do not affect certain areas. We can see, something of a, I don't want to say slack, but most states that are not heavily affected by this condition, we just focus a little bit on treating those that are currently affected rather than working on preventing a high transmission rate. So would you say that states that are not heavily affected should still join, the effort or the endeavors to making sure that there is a mass vaccination to prevent an increase in the spread, or their primary focus at this time should be just treating those that have been affected?
Any silent state, when I say silent state that are yet to start reporting, that does not exclude the reality on ground that probably they could have 1 or 2 cases. The question is anybody looking for those cases in those states? Let's assume they don't have. This is the right time that they don't have to start organizing for mass vaccination campaign. This is the right time for them to improve surveillance, to set active care search teams to look for these cases. If they don't see them, then they'll be able to vaccinate all the targets. If they'll be able to improve routine immunization, probably they might not be able to report a single case, because by the time it will come close to their state, they would have improved the immune system, what we call the baseline herd immunity, to be able to resist the transmission of this infection. So for me, it is not time for them to rest. This is the time for them to improve surveillance and improve routine immunization. And if they get chance, they should even go on to conduct mass vaccination campaign.
Right. You're hearing the voice of the Kano State Deputy Director, Public Health and State Epidemiologist for the Ministry of Health, Dr. A.I. 𝗪𝗪𝗁. He's talking to us about diphtheria book. So you can join us and see everything happening live in the studio and also be a part of the show if you don't have access to your radio. Mainland 98.3 FM. Check us out on Facebook. We're streaming live. Please join the show. You can even take advantage of that and drop your submissions using the live chat option. All right. That is, if you have questions for the doctor, I would relay the message to him as you drop the messages on Facebook. Mainland 98.3 FM is how you find us there. My name is Sage Babalola, and I'm still talking to Dr. A.I. 𝗪𝗪𝗁 about diphtheria outbreak in Nigeria. So, doctor, what are the recommended preventive measures, or should I say strategies, to control the spread of diphtheria? I'm talking in the general sense now. You have spoken to us about the specific effort of the Kano State government, and like you said, whatever strategy you come up with should be state specific, depending on the spread, number of affected persons, amongst other things. So, but generally, what are some of the recommended preventive measures or strategies in controlling the spread of diphtheria?
Okay, so thank you very much. Let me divide these preventive strategies into 2 broad arms. One arm is for those states or those places that do not have cases of diphtheria, or for people who have not been infected or are not at a higher risk. These are people that now requires improvement in the uptake of routine immunization. They need to work on improving the coverage of their routine immunization service. Because like we rightly said, a weakness or breakage in the system, or maybe hesitancy and other factors that affect the coverage, is one thing that is predisposing us to the diphtheria infection in the country. So improving vaccination coverage is one key way of preventing resurgence or outbreak of diphtheria. And for those older adults who have not been infected and who are not living in those infected or epidemic zones, they should try to get vaccinated using the recommended vaccine. So it's not just for children, because every age group can be a high risk. Now, for states like Kano and all the other states that are already having an active outbreak going on, the preventive measures are universal. One of them, which is very, very important, is improved surveillance. Improving surveillance, I mean active case search and contact tracing, to ensure that you restrict the community transmission. If in a family of 10, 2 are infected, you are able to pick up those 2 and put those remaining 8 under your watch mode, restricting their movement around. You would have controlled or prevented the spread of this infection from that household to even the neighboring or nearby household. This is very, very important, because when people don't know, when nobody is there to help them do it, they end up going to do it and end up spreading it. Another very important strategy is, of course, the use of the improved hand hygiene. Make sure you wash your hands regularly. Use hand sanitizer. If you touch any of those used materials like tissue, ensure they are properly disposed. It is a bacteria. Touching those and sanitary waste can get you infected. Or not washing your hands, you would have touched one place or the other. You would have handshake with somebody who is dead, and you touch your nostril or mouth, you can get yourself infected. And then another important strategy is the wide use of what we call face mask for older children. Since it is transmitted via respiratory droplets, use of face mask will help in protecting you against diphtheria and even other respiratory or airborne diseases. Because by doing that, you are protecting yourself from inhaling those respiratory droplets. Very important preventive strategy is prompt reporting at a nearby facility. If you have a child that has some symptoms, do not hesitate to go to the nearby hospital. By doing that, you are preventing the other children at home, you are preventing your own self, you are preventing the members of your community. And in the hospital, they will do the needful by triaging to make sure if it is diphtheria, they refer to the treatment center. If it is not, they will now give other medications that are necessary. Another preventive approach is in the hospitals. Doctors and other healthcare workers are advised to have this high index of suspicion. Any child, any adult with respiratory symptoms should be thoroughly evaluated for diphtheria. And a clinician or healthcare worker doing this should get his own self-protective by using the appropriate personal protective equipment, putting your hand gloves before examination, wearing your face mask, or where necessary putting goggles that will avoid splash. Western material should be appropriately handled to avoid spread for people that will come in contact with them. And for the treatment center, strict adherence to the isolation protocol, making sure that the contact or the primary caregivers are not allowed just anyhow into the treatment center, will help in preventing the spread. The healthcare workers are there well trained. So if you bring your child, they'll tell you the protocol. They'll give you what we call prophylactic antibiotics to protect yourself, and they'll take care of your child. The issue of having visitors from far and near coming to see your child in the treatment center is not encouraged because it breaches the protocol. But the most important preventive strategy is the mass vaccination campaign. Because by doing this, we are improving the immune system of every other person in the community, such that the herd immunity level of that community will be improved to the level that the transmission in the community can be prevented entirely.
Right. Thank you so very much for that very comprehensive analysis. Now, I don't want to sound pessimistic or scare anybody, but it is, of course, my job to explore every outcome or possibility. Dr. Aya, I know that during the coronavirus period, for example, it was a lot of nonchalant attitude towards that particular condition. And at the end of the day, we had a lockdown, for almost a year. Do you think that this condition, diphtheria, is potent enough to lead to the possibility of a lockdown, especially if you think about this against the backdrop of the efforts that different government and health organizations are trying to employ to control it? But then, do you think that there is even the slightest possibility that this infection might be potent enough to cause the government to decide to go on a lockdown, as we saw during the coronavirus period?
So thank you very much. I think these are high-level decisions that needed to be considered at the higher level, even though the sources of this decision comes from the lower level, that's the technical people coordinating this response. Let me commend the effort of the federal government. Recently, the Honorable Minister has established a ministerial task force, and this is coordinating, helping other states to ensure we contain the spread. So for now, nothing is impossible. Let me say that any disease that can claim a life is worth getting all the necessary attention. If you look at the mortalities from COVID, if we don't take diphtheria very serious, the number of deaths may even supersede those coming from or caused by COVID. So I think it's the right time for us to critically appraise the situation and put more effort in doing the mass vaccination campaign. It is our hope that if we continue to do this, probably we might not reach to that level of putting a lockdown or closing down schools and so on. I think evidences have shown we are making progress, and with the level of awareness, the community members are equally getting interested by contributing their own in strictly adhering to the preventive protocol and, of course, of taking the vaccination. So we hope if the community members continue to contribute, we will not reach that level of the lockdown. But nothing is impossible, because it is worth taking all steps to prevent and protect the lives of the people.
I appreciate your optimism, Dr. Karamata. Okay, so what are the available treatment options for diphtheria, and are there enough evidence to suggest or evidence that adequately represent the success rate of the treatments that are available at this time?
Yes, beautifully, diphtheria is a treatable and curable disease. It's a bacterial infection, and it is treated using antibiotics. There are a good number of antibiotics that are found to be very sensitive and effective in the treatment of diphtheria. And this is exactly what we are using in the treatment center. A good number of people have been cured completely from diphtheria. Where we have challenge is the fact that the diphtheria, the bacteria, 𝗪𝗏𝗏 𝗪𝗏 secretes a toxin called diphtheria toxin. This toxin is the one that causes the multi-organ damage in the system. And the antibiotic can only cure or kill the bacteria, but it cannot reverse the effect caused by the toxins produced by the diphtheria. So the best way to treat and reverse the effect of that toxin is the use of what we call diphtheria antitoxin. So diphtheria antitoxin is one of the necessary requirements now for effective management of positive cases of diphtheria, especially in those advanced cases where the toxins are produced. So one of the major challenges now is struggling to make the diphtheria antitoxin readily available to all the treatment centers, to all the hospitals. With the diphtheria antitoxin available with antibiotics, I don't think anybody should die from diphtheria anymore.
So, doctor, you're saying that even in cases where a person is being cured, some of the symptoms that the person suffered from might still pose as a problem to the person. You'd have to deal with the symptoms individually, even if you're treating them with antibiotics.
So what I'm trying to say is, while the antibiotic tries to kill and get rid of the bacteria from the body system, the toxins already produced has its own effect on the system. And the only way to handle those negative effects of the toxin is to use the diphtheria antitoxin. So in a situation where you don't have the antitoxin, you will only rely on the antibiotic. Yes, the antibiotic will get you cured, but the negative consequences of having the toxin that has not been neutralized because of unavailability of antitoxin will lead to some complications in life. Some of them, after 1 or 2 weeks of discharge, they come down with complications affecting kidneys or heart or the nervous system. Because at the time they were receiving treatment, there is no diphtheria antitoxin to neutralize the effect of that toxins produced by the bacteria.
Right. Thank you very much. Dr. A, we're going to round off this conversation in just a few minutes, and I would like to ask you my last question. Based on the reality of what's happening in our health sector, is a lot of reports that have been, written about some of the deficiencies going on in the health sector, the lack of resources, even healthcare workers, among other things, right? On a national scale, do you think we have all the resources needed to manage viral infections? And now we're speaking more specifically about diphtheria. Do you think we have enough resources? And I'm not just talking about money. I'm talking about personnel. I'm talking about experts. I'm talking about research resources, to help us in dealing with situations like this one. Are we well equipped to deal with this on a national level?
Let me say the honest answer is no. not only for viral disease, even bacterial disease like diphtheria, because diphtheria is bacteria. Yeah, let me say that why did I say no? Because diphtheria is a vaccine preventable disease. Even if you have the personnel, the other necessary things required to manage it effectively include the diphtheria antitoxin, which is not readily available in the country. As we speak, sometimes you go out of stock for some time. That's why I commend the effort of NCDC for struggling to ensure sustained supply of these diphtheria antitoxins. But sometimes it goes beyond them. Sometimes it is out of stock for the entire country. So this is a wake-up call for all the policymakers that we need to do more. Probably we need to begin to think that the rate at which the Nigerian population is expanding, we need to reach to that level where some of these life-saving commodities can be produced locally in our country. You can imagine if we can produce the diphtheria antitoxin in this country. All we need is to mobilize finances and produce as much quantity as possible that is needed to save lives. Another very important reason why I said no, it is a vaccine preventable disease. We have been struggling to conduct mass vaccination campaign, but because the vaccines are not readily available, we couldn't do so as planned. Let me commend MPFCDA and the Federal Minister of Health for struggling to get these vaccines now. But as it is, the vaccine might not be enough to go around. If we have enough vaccine, this is the time for you to conduct mass vaccination campaign across the entire 36 states and FCT. Whether state is reporting or not, every other person is at risk. So for me, the answer is no, because we still continue to rely on others, especially the donors, to do so. While commending, of course, the effort of the government, I think we need to do more. All these vaccines, we need to copy from other countries. If you go to India, the public health system is so rapidly evolving that they are now able to manufacture some of these vaccines. They are able to do a lot of things. So we need to do this. Dependence or over-dependence on donors and other foreign aid, I think, is indirectly contributing in somehow not making us a very serious system of trying to rely on our own selves.
Dr. A.I. Karamata, we appreciate your honesty, we appreciate your time, and of course your analysis and all the information, all the inside information you've given us about diphtheria outbreak, not just in Kano State, but also in the country on a national level. Thank you so very much. Again, I will still say we appreciate you for your time. This is a very, very busy period for you, being the state epidemiologist for the Ministry of Health in Kano State, and Kano State is not exactly having a field day at this time. So thank you. We're seeing